Hello everyone, the topic of today is Ebola virus. What is Ebola? It is a disease that was found from 5 species of genus Ebola virus. It has been identified from sample collected from human and non-human primates during the outbreak of the disease in 1976. Ebola and Marburg hemorrhagic virus classified as biosafety level 4 pathogen BSL-4 risk group require a special containment measures and barrier protection in healthcare workers. The analyzation of the situation. Ebola virus disease outbreak in West Africa in the early February 2004. It involved Guinea and Liberia. The first cases were reported from southern eastern Guinea. As of 7 April 2004, the Ministry of Health in Guinea reported 151 cases of Ebola, 54 of which were laboratory confirmed by PCR, and 95 of those people died. Liberia reported 21 cases clinically compatible with Ebola, including 10 deaths. Mali reported 6 cases, 2 of which tested negative. Accumulation of 3 weeks challenges of the outbreak were given. It is likely that the more cases will be identified. Tourists, visitors, and residents in affected areas are at low risk if the precautions are followed, like avoiding contact with symptomatic patients, body fluids, and corpses. Generic precaution for traveling in Western Africa countries: avoid close contact with live, dead, wild animals, and bush meat. Wash and peeling fruits and vegetables. Practice safe sex and follow hand wash routine. Those who are providing medical care are advised to wear protective clothing, masks, gloves, gowns, and eye protection, and practice proper infection prevention and control measures. Identifying target stakeholders. The Liberian Ministry of Health announced that the outbreak of Ebola virus confirmed 16 suspected cases have been reported from Lava, Nimba, Bonga, Manserioda, and Magibi countries in Liberia, which 10 have been fatal. 3 cases occurred in healthcare workers of all died. 6 April, a patient hospitalized and 26 remain under observation. Sierra Leone reported 2 fatal cases of viral hemorrhagic fever. Another country is Guinea. It targeted the tourists returning from affected countries, visiting families and friends, exposed personalities seeking medical attention in AV aircraft, passengers exposed to Ebola during flight, and healthcare workers in affected countries, laboratory samples shipped to the laboratory. Formulating the message. People from affected countries as well as the unaffected countries should be aware of Ebola virus disease early symptoms, which are fever, headache, diarrhea, vomiting, stomach pain, unexplained bleeding and bruising, and muscle pain. Ebola only spread when people are sick. A patient must have a symptomatic to spread the disease to others. After 21 days, if an exposed person does not develop symptoms, they will not be sick with Ebola. Symptoms can only appear from 2 to 21 days after exposure. One gets Ebola by blood, by body fluids, needle, medical equipment.
Go.
The message implementation. The message of Ebola will be broadcast through social networks, advertisement, internet, and mass media communication. The budget of Ebola. For South Africa, we will need about 300 million to create Ebola awareness through television, magazine, campaigns, and hospitals, as well as clinics. We will need to test every person who would like to be tested and who lives in South Africa. With the evaluation of Ebola, the campaign will be working with hand in hand with the Minister of Health, the Minister of Foreign Affairs, the military sector, to measure our success in the issue of Ebola. We will make sure that the campaign is effective so that people may not be scared to come and get tested. The review indicates that a low risk of transmission in the early phase of symptomatic patient, which is prodromal phase, around 7 days. Secondary transmission only took place if direct physical contact occurred. No transmission was reported without direct contact with a sick person. The higher risk is when exposure took place during the late stage of the disease. Thank you, ladies and gentlemen.
Okay.
Now we're having an interview with Mr. Eddie. Good morning, sir.
Morning, how you doing?
I'm good, sir. Can you introduce yourself?
Yes, my name is Eri Chilenge. I'm from the DRC, and yeah, I'm a student here at Val University.
Okay, that's great, sir. Sir, can I ask, what do you think of Ebola?
Well, I think Ebola is a fatal virus that's affecting Africa in a very negative way on a large scale, and very contractable.
Okay, thank you, sir. So, do you see Ebola as a dangerous thing?
Yeah, I think Ebola is very dangerous. Well, the symptoms are here that you can contract it simply by simple interaction like a greeting or someone breathing by you. So I think it's very dangerous, and the fact that you die very quick.
Yes, that is true because it contracts through fluids. Okay, thank you, sir.
Thank you.